I think most people would rather be busy at their jobs than bored. And unfortunately, both of those things can happen at the same time. Dentists aren't immune to being overworked and bored. Advertising on price and insurance acceptance brings a stream of low case value patients that are looking for cleanings and extractions and fillings. Dentistry should be more than a daily grind. And after the break, I'll tell you how to see fewer patients, have more satisfaction, more energized staff, and make more money. Stay tuned. I'm Colin Receiver. Thanks for watching the Patient Attraction Podcast. If you have more dental patients than time, many dentists would envy you. Now, you may not be feeling all that grateful though. I've talked with a lot of dentists recently who say that they're not only booked, man, they're overbooked. And those dentists are nearly running between the operatories trying to keep up. Now, to be sure, they're making money, but they're paying the high price in terms of stress and fatigue and even boredom in some cases. So are their staff. Now, whether they intended to or not, they're running the high volume practices. That means their average case values probably aren't all that high. It's basically dentistry is a commodity business, which is not the best way to run your practice. Now, don't get me wrong. If being overwhelmed with patients is your idea of success, have at it. But how long do you think you and your people will be able to keep that up? And what impact does that have on your staff morale and retaining your A players? There's a better way to practice dentistry, and that's to attract better patients. Now, if you're hip deep in low-value patients right now, you might not think the better patients are out there, but nearly every market in the country has dental prospects that have that discretionary income and are looking for the right dentist. In fact, it represents anywhere from 30 to 40% of any given market, in some cases more. And there is a path to working less but earning more if you're willing to change your approach. Now, put that way, it might sound like a no-brainer, but you'd be surprised how many dentists I talk to that are resistant to that idea. If you're open to getting higher case value patients, you'll need to change the way you market. You won't get better patients by simply advertising low price or insurance acceptance. Now look at it this way. If someone is prepared to spend 50 grand on a new car, do free oil changes really influence which one they'll buy? No, not really. Those higher end buyers are much more interested in the quality or the safety or the performance of that vehicle and how they feel when driving it. Your marketing has to convince those better prospects that having you as their dentist will yield the highest level of satisfaction. It's all about the experience. It doesn't need to convince them that they'll save a few bucks because they really don't care about that. Dr. Dick Davenport from Texas was looking for more than just low case value patients, and he found a way to attract them. He said, quote, "SmartBox is a total dental marketing company. The companies that I worked with in the past did nothing more than just develop a new website. They didn't even do that very well, but that's all that they did. SmartBox looks at the whole package, and they try to figure out what you need to achieve your individual goals. It's not a cookie cutter service, it's personalized, and they look at your market area to figure out what will impact your practice in the most effective way." Now, whether you're drowning in patients or just tired of working too hard for too little, check out this as your next step. Give us a call. Let's chat about your goals, your capabilities, and your market area. We'll build out a strategic plan and put together a roadmap to get you from where you're at now to where you want to be. Now, I'm not going to tell you how to run your dental practice. I'm going to tell you about the opportunity that you have to thrive. And there's more out there if you're willing to change. Join me for our next podcast. Until then, keep moving forward.